About COPD and exercise as a revision session. Now, my aim today was to be able to broadcast this revision session on both the Pure Training and Development page, where you're watching now, and also our new training hub page called the PTD Hub. But unfortunately, technology is not allowing us to do it, so I will be sharing this later. So if you're watching the recorded video, you might end up seeing it on the PTD Hub a bit later. And if so, if you have any questions or anything that you want to join in with, then make sure you put them in the comments below and I'll speak to you about them afterwards. So hopefully all of you know about the PTD Hub that's currently on the Pure Training and Development page. If you don't, then head over to @PTD Hub and have a little look at the new training hub that we've launched for fitness professionals this week. It is brand new and we're trying to share the love on it. So if you could please make sure that you have a look at it and then share it with any fitness friends or anyone that would benefit from it, then that would be really ideal. But for today's training session or revision session, we're going to recap on COPD and exercise. So COPD stands for Chronic Obstructive Pulmonary Disease. And you may have worked with clients in the past, or you may have a new client coming to you with this condition, or you might just be wanting to prepare yourself in case somebody does come with this condition. And it is important to do so because it is one of those conditions that isn't fully understood until you actually do a training course on it, because it's not so prevalent, if you see what I mean, and combined to like obesity and diabetes and high blood pressure. It's not one of those at the top there for people being familiar with it, whether they're in the fitness industry or not. So let's just understand what it is so that we can help our clients more effectively should they come to you with this condition. So as I said, it stands for Chronic Obstructive Pulmonary Disease, and it is an umbrella term for two different conditions, which include bronchitis and emphysema. So there are other conditions that also fit into this COPD category, but the main two are bronchitis and emphysema. So bronchitis means anything that ends in itis, often means inflammation. So here we're talking about the inflammation of the bronchi, so the main airways. Now, if someone has inflammation in the main airways, then of course they're going to struggle to get oxygen in and out. And it's the same for an asthmatic when they're having an asthma attack, but only it's not a temporary thing or a bout of like an asthma attack is. It's ongoing, it's a permanent change in the body's anatomy. So they don't get any recovery or any break from that. Okay, so we've got inflammation of the bronchi is one of the first conditions within the COPD umbrella term. And then the second one is emphysema. And emphysema affects your alveoli. So your alveoli are your air sacs at the bottom of your airways, and they're responsible for gaseous exchange. So they allow for oxygen to come into the body so that we can utilize it effectively, and carbon dioxide to be removed. Now, when someone has emphysema, the alveoli, so if you picture it like a bunch of grapes, when they're all nice and tight together, they're all neatly structured, we get the most effective gaseous exchange possible, and therefore people can breathe a bit better. But as the condition gets worse, the alveoli, or the grapes in this analogy, they get bigger, they get loose, and therefore the surface area is reduced. So the amount of capillaries that are wrapped around the outside of the alveoli diminishes, and as a result we can't get as much oxygen into the body and we can't get as much carbon dioxide out of the body. So as you can imagine, someone experiencing either of those two conditions are going to feel very breathless, they're going to maybe be wheezing, and in the case for bronchitis in particular, people typically produce more mucus through the airways. So your membrane within the airways secretes mucus. And with this particular condition, it increases further, and people typically need to bring up the mucus in order to be able to breathe. So it's not a very nice condition as it gets more severe, because people need to do things like bring that mucus up in public. So you need to be aware of that. So on that note, the condition itself, COPD, really can range. It can go from very mild, where you wouldn't even know that someone had the condition. In fact, I've got people in my referral classes with COPD, and in particular bronchitis, and you really couldn't tell. You know, they get a little bit breathless towards the end of the session, but very little. It's more of an anatomical change and a reading, obviously done with spirometry. Then I've got to the extreme of people with quite severe COPD, and in their case they actually have to carry oxygen around with them because their oxygen levels are so low without it. So it's very varied. You have other versions, as I say. So if you have a client come through that doesn't either have emphysema or bronchitis, then you might want to do a little bit more research into that, and we'll cover other ones in other revision sessions. So you've got those two main categories, so you can understand a little bit about the anatomy behind them. The progression of the signs and symptoms for the person isn't just always about the breathing. So yes, they're going to be short of breath, and when they've got moderate to severe COPD in whichever kind, they'll definitely find sort of activities of daily living like dressing themselves, moving around, going to the shops, challenging. As it gets more severe, it's going to get obviously harder for them to do those activities of daily living. And on top of that, because they will cut down on doing them, we're going to see things like diminished strength and endurance of the extremities. So often we see people with this condition have very weak arms and very weak legs, and that's combined by they're not doing the activities of daily living because they can't breathe whilst they're doing them, but also because if we can't get as much oxygenated blood to our peripheral limbs, we can't get it there because we're not getting the oxygen into the body, and therefore we can't send it to the rest of the body. The muscles waste away, so we get muscle wastage in association with this condition, which is why as fitness professionals it's really important to make sure that we integrate training that works the arms and the legs. So then that kind of brings me on to the training element. Now when it comes to exercise, you need to really kind of empathise with someone with this condition, especially if it is moderate, because they're going to be breathless at rest anyway. So they're just sitting here like I am now, maybe like you are now, and they are panting and they are wheezing and they're gasping for breath and they're not doing anything. And you're then asking them to do some exercise or some physical activity of a kind. So you can imagine how daunting that can be for someone, because they can't breathe anyway at rest, and you're asking them to do some exercise. So for a lot of people, that puts them off. That's like a barrier to exercise that we have to try and work with people to overcome. For others, it's not necessarily a full barrier, but a worry or a concern. So you need to think about how you approach it when you first meet the client. Make them feel at ease and understand that you're not going to be making them work really hard 100% of the time. Get them to understand that you will allow them to have breaks and you will work at an intensity that's suitable for them. So you need to first of all really empathise and don't just go straight into the training session and explaining how you can help them. So take that first stance. Then think about the type of exercise. So whether you're in a gym, whether you're running circuit training classes or you're exercise to music, it doesn't really matter what environment you're in, but you need to think about the type of exercise and the layout of your exercise. So for example, if I'm in a circuit training class, that's probably one of the most ideal environments for people with this condition, because they do a little bit of work, they have a little bit of rest. They do a little bit of work, they have a little bit of rest. That's the structure of circuit training, only the rest breaks would be a little bit longer, more than I would give anyone without the condition, let's say. So that's ideal. If you're in a gym, it doesn't mean that you can't do gym-based exercise or say continuous exercise on a treadmill or rower or bike. It just means that you need to think about the intensity, the level, and you might need to break in between that. So you might do 2 minutes of walking on the treadmill and then take it to a pause and then slowly build it back up again. So it's all about trying to find the best way to make exercise intermittent, especially to begin with, particularly if we're talking about people with moderate to severe COPD. But like I said at the beginning, if someone only has mild COPD, then actually they could probably do the same program as someone without the condition. You just need to be aware of analysing how they feel. Now, in terms of controlling symptoms, most people with the condition will be carrying the same things as people with asthmatics have, so a bronchodilator, a blue inhaler. And the idea of the blue inhalers are they're fast-acting stimulants, so they open the airways quickly to allow adequate oxygen airflow in, so therefore oxygen into the body. Some people would find it beneficial, and this is not me telling you as a medical professional, and of course you can't tell them that either because we're not doctors, but they may choose to take their inhaler before they start exercising because it opens up the airway and therefore allows them to start off in a better place than starting off struggling and then it just getting worse. So think about making sure that you check that they have their inhaler on them in the first place, and make sure that you get them to use it on a regular basis as well if they need to during the class as well as before it. Now, the overall style of exercise, we want to try and integrate a slow and gradual warm-up, a fairly steady state main session with regular breaks, and then a slow and gradual cool down. And it's really important to do that, because if not, you're just going to suddenly place a demand on the body which it can't cope with. Now, just like you or I, if we just suddenly started exercising, like I got up out of the chair and I started jumping around and moving around, obviously all of the systems in the body suddenly need to change. Your heart rate needs to increase, your breathing rate's then going to increase, your muscles need to be warmed up. All of these different changes in the body are suddenly being impacted. And when you have COPD, that therefore is going to make you straight away breathless, because it would make you or I breathless, let alone when our systems aren't functioning properly. So it's important to slowly, gradually build that up. So it might literally be a case of toe tapping on the floor, doing mobility exercises to begin with, and then building in the cardio element. In fact, in our GP referral course, some of the sample exercises for COPD are as simple as just doing some shoulder rolls and making sure you mobilise the main joints of the body. Get them to stand up and down from a chair, for example, for maybe like 5 or 10, and then they have a break. It's very slow, especially for someone with moderate COPD to begin with. But I have first-hand experience of people really fighting back with this condition. You'll have some people that almost give in to it, not necessarily the ones that you will see. I mean, people that have the condition, they may well just give in to it, and they get down because obviously they can't do as much as they used to be able to do. So it really can affect people's mental well-being. Others, however, take the stance of like, this condition is not going to beat me and I'm going to find a way around it. So then they're quite passionate about trying to move and be active as much as possible. And the people that I have in my class, and over like the last year, for example, have at least sort of 7 or 8 predominantly coming through regularly with that condition, have been of that mindset, like, I need to keep myself moving because if not, I'll only get worse. So they're very good at monitoring themselves. But what they're also really good at is telling other people about how to exercise effectively for their breathing. And what I mean by that really is how to breathe effectively. So one final thing I'll say related to exercise and the condition is they must learn to breathe from their diaphragm if they want to be able to get their breath back. Now, if you think about yourself when you've been for a run or you've done something which has really got your heart rate and breathing rate up, people often do that whole like lean on their legs, bend over and pant until their breath comes back. Now, obviously that's not the most effective way to breathe, and it's certainly not the most effective way to get your breath back because you're actually closing the thoracic cavity by leaning down. So what you want them to do is you want them to sit back, shoulders back and down, put one hand on their stomach, one hand on their chest, and make sure that when they inhale, their stomach rises, and when they exhale through their lips, so pursed lips, their stomach will go in. So if you just think about that for a moment, maybe put one hand on your stomach and one hand on your chest. Breathe in through your nose. Now, is it your stomach that's rising or is it your chest that's rising? It should be your stomach if you're breathing from your diaphragm. So you should belly breathe, is what some people say. And as you breathe out through pursed lips, your stomach should come back in again. So think about that. Try and learn it yourself if you're not currently breathing from your diaphragm, because that's better than panting or hyperventilating breathing, so you're breathing higher up in the respiratory system, because you need to breathe faster and quicker to get your breath back, and it takes longer. So think about that for yourself so that you can actually teach your clients to do that more effectively. Right, I hope that's made sense so far. Let's just recap on a few bits that we've just gone through in that quick revision session. So COPD is an umbrella term for chronic obstructive pulmonary disease, and within that umbrella term we have chronic bronchitis, which is the inflammation of the airways which secrete extra mucus and make it harder to breathe, and emphysema, which is the destruction of the alveoli being the end of your airways where we have gaseous exchange occur. Now, with those two conditions, it can range from being very minor to very severe. So you need to judge based on what your client says on where they are in that spectrum. Then we want to integrate exercise on a regular basis, but we want to make sure that it is structured in a way that is conducive to effective training for them. So slow and gradual warm-ups and cool-downs with an intermittent effect. So we have a bit of exercise, a bit of rest, exercise and rest. Making sure that people understand that they aren't going to be expected to exercise at a high level of intensity or continuously, because the fear factor will be there as they may be struggling to breathe at rest. And then in order to get the most effective technique when it comes to exercise, you need to make sure that you teach good breathing control. So that's both at rest and on exertion when they're trying to get their breath back by using diaphragmatic breathing. But on top of that, making sure that you teach them to breathe out on the hard phase of something and breathe in on the easy. Okay, so hopefully you found that helpful, just to recapping a little bit on the condition. Obviously there is a lot more information to this particular topic, and we can do that over future revision sessions, or if you are an exercise referral instructor or fitness professional and you would like to learn a little bit more, then we do have an online seminar which just takes 2 hours to complete, and that's maximum, to be honest. It just involves listening to some audio training and reading, all on the topic of COPD and exercise. So I'll put the link above this or below this so that you can access that if that's of any interest to you. If you have any questions about this topic, then please put them in the comments below and I'll get back to you to help you. So next week our live revision session will be on diabetes, because it is Diabetes Awareness Week. So I'll speak to you then. Okay, bye.